A new AARP report suggests the economic value of family caregiving in the United States has surpassed $1 trillion annually. That's equivalent to nearly 50 billion hours of work and 17% of the entire U.S. full-time workforce. But many of these caregivers go without pay to help their loved ones. To talk more about this, let's bring in Dr. Myechia Minter-Jordan. She is the CEO of AARP. Good to see you. Thank you for coming in.
Thanks for having me.
So your last report was from 2 years ago, and you valued caregivers' contributions at $600 billion.
Yes.
Why is it growing so fast?
Thank you for having me, and thank you for bringing visibility to this important topic. This is truly a wake-up call for all of us, because if we are not currently a caregiver, likely we will either need caregiving or become a caregiver. And so when I think about this report and why the number has jumped so dramatically, as a physician, I'm really bringing forth the complexity that care now has when we think about chronic disease and how much that has increased in our country. The complexity of care that's increased, we're now at $1 trillion. And when you think about that number, it's the equivalent of 24 million people delivering care valued at $20 an hour. And so when you think about that number and the gravity of that number and this care that's being given by so many caregivers around our country that is undervalued, unrecognized, this should be a wake-up call for all of us.
Wow.
Certainly. I mean, earlier this week we've been talking about Amanda Peet and the emotional toll of caregiving.
Yes.
I mean,
Especially
this
for the
is
sandwich
a financial,
generation.
the financial piece of it is startling. So I'm glad that we are talking about it. There is a tax credit for caregivers that's going through Congress. What would that look like?
So credit for caring is a tax credit that we are advocating for that would put more dollars back in caregivers' pockets. Right now, caregivers expend almost over $7,000 a year at taking care of their loved ones. They're balancing full-time jobs. They're working a full-time job as a caregiver. And when I think about the impact of this, I think about members that I've interviewed, in particular one woman, Anna Tris, who lives in Florida, taking care of her mother, and using her retirement savings in order to be able to do that, buying medications and really focusing on how to get her mother transportation. So all of these factors mean that caregivers need relief, and so this credit for caring tax credit would allow us to do that in part. And part of it, again, is bringing visibility to this issue. So not only are we focused on tax credits, but we're focused on what are the resources that caregivers need, both locally and nationally.
This is a uniquely American phenomena in a country that is the wealthiest country in the world, but doesn't offer proper health care to its citizens, and also caregiving is lacking. You don't see it outside in, for example, parts of Europe. So would a serious national caregiving policy in this country actually cost $1 trillion?
So I leave that to our politicians to figure out the dollars, but I think part of what we want to do is make sure that we're bringing visibility to the people who are working full-time jobs, who are taking care of their caregivers, their loved ones, and not getting any sort of relief or reimbursement for that care that's being expended. And when you think about the value of the economic value that they're expending being $1 trillion, we need relief. This is a wake-up call for all of us.
So to that point, I mean, we talked about the potential tax credit, right?
Yes.
That's going to be something that would take some time. But for those that are going through this right now, I mean, where can caregivers and their families turn for help? What resources should they be looking at?
Yeah, so I'm really grateful that you asked that question. AARP has a number of resources that we offer to caregivers. This is all for free. In many countries, many states around the country, we also offer a partnership with 211, where caregivers can call 211 and find out local resources in their communities. So we want to make sure that caregivers know, A, that they are not alone, that we are fighting for them, and that the value of the care that they are giving to their loved ones is significant and exploding given the complexity of care. And we want them to know that there are local resources that are available to them, and that we are fighting for them every day, both locally and nationally, to ensure that they get the credit and the resources that they need to be able to do this important work.
It's such an important endeavor. Dr. Minter-Jordan, thank you so much for sharing it with us.
Thank you for having me. Yes.